you're right. Kind of putting on the time machine goggles in 2012, 13, 14, when I was looking at healthcare companies, there was a lot of interest in introducing technology to traditionally like services heavy, pretty antiquated systems. And early discussions again stemming from ACA innovation and how we can change reimbursement models to expand access, improve quality, reduce costs. We know in our country that we have some of the worst outcomes for the spend, and that there's a ton of opportunity to bridge that gap. And it was early innings. A lot of the new entrants in healthcare failed to appreciate the very complex payment kind of, cash flows. You could do a really phenomenal job taking care of patients, and it may not translate to payment if that person isn't paying out of pocket. They rely on their third party insurer or potentially an employer and multiple layers within that employer, and who's measuring risk and the outcomes that matter to them, the reporting that needs to be done, and the compliance considerations. Marketing and advertising in healthcare is also not always intuitive and changing all of the time. So there were a ton of learnings and a lot of brave entrepreneurs who were building during that time, figuring it out. And we stand on the shoulders of giants now and having much clearer guidance about how to work in a B2B2C system and appreciate some of the regulatory guidelines and the speed of scale that's possible to do safely in healthcare services.